In this episode of Operators, I spoke to Dr. Kristiyana, who is a pediatrician, but has also pivoted and now works in pharmaceuticals. It was a great chat. Spoke a lot about future of pharmaceuticals, but also about what it's like to be a pediatrician and have to deal with the US insurance system. So, hope you enjoy. Like, what is your journey from practicing medicine to pharmaceuticals?
Yeah, so I've always been interested in precision oncology, which is essentially looking at specific biomarkers that patients with cancer have and tailoring therapies accordingly. And so I knew I would transition at some point. So that was always the plan. And like I mentioned earlier, I spent about 5 years in the diagnostic space working on developing biomarkers, including circulating tumor DNA for minimal residual disease and solid tumors. And I wanted to complete the puzzle and get drug development experience. And then I've been at my current company for about a year now. So that's been quite rewarding, getting to clinical work and take care of patients with cancer, working on the diagnostics and data piece, and now working on developing these novel therapies to hopefully help improve outcomes for these patients.
And like, how do you get the experience to be in pharmaceuticals and to be in a leadership position? It seems like something that would be very difficult to do, like a job interview for that. Like, I don't know what you would need to say to prove to them that you would even be good for that position.
Yeah, I mean, I think if you're a good clinician, you probably have most of those skill set. And I came from industry, from the diagnostic space. I already had a pretty compelling corporate experience and have demonstrated the ability to advance diagnostics from concept to the clinic. And so at the end of the day, there's lots to learn within drug development, but a lot of the skills are translatable. And so if you have the clinical skills, and in my case, additional skills in the diagnostic industry, and have demonstrated success, then it's a pretty compelling story.
And as far as like pharmaceuticals in the US, I feel like pharmaceuticals sometimes gets a bad rep, especially with the current administration not getting into
Yeah.
politics. But like, what is the future of pharmaceuticals in America? Like, what?
Yeah, I mean, I think in order to advance the field of medicine, we need to keep working on new drugs. As you know, particularly in oncology, where I work, there's a lot of work to be done. Still, a lot of patients lose their life to cancer, and the ones who don't suffer a lot of morbidity due to toxic side effects. And so there's a lot of effort to improve outcomes and improve the safety profile of these drugs. It's not a cheap process, right? It's an expensive process. And so I think pharmaceutical industry gets a, a bad reputation because I think the general population doesn't quite understand why it costs so much money to get a new drug out. And the truth is, it's a long process and there are many steps. Um, the manufacturing is quite expensive. There are large teams working together. And so research and development does cost money. Um, but I think it's absolutely essential if we want to improve the lives of people in the US and globally. I work for a global company, but yeah, it's just the reality of it. And I think if drug prices are reduced substantially, then there wouldn't be budget for research and development, and there would be stagnation in terms of progress in that space. And so think perhaps the place where we need to be looking at is not necessarily reducing drug prices, but improving insurance reimbursement for patients. I think that's where, um, there are potentially a lot of costs that then go to and revenue that goes to insurance companies where money can be saved to help improve access to these drugs for patients. Um, insurance people who work in insurance companies may have a different opinion, but
I was about to say, well, that
yeah.
was actually my next question. One of the things we're building here at Caesar Health is we want to build an AI insurance system. So
Mm-hmm.
when a patient comes into the clinic throughout their entire process, everything is documented with AI. Everything is properly, maybe a doctor forgets something. The AI goes, hey, you forgot this. It needs to be marked. What's your thoughts on it, on the insurance companies in the States?
Yeah, I mean, I alluded to that. I think it's difficult process with very limited transparency. I think even for myself as a physician, um, I've had issues with insurance companies as a physician and as a patient. Um, as a physician, certainly having to do prior authorizations to get things like scans or drugs approved for patients that I know are the right choice. And often physicians have to do these peer-to-peer meetings to justify why they need to prescribe something for a patient that it's very time consuming. Vast majority of times you're actually not talking to a peer, you're talking to someone who is not a specialist, has a lot less experience. So as a pediatric oncologist and I subspecialize in pediatric neuro-oncology, I ended up talking to people who have physicians but have no specialty experience in that area, and so you end up wasting hours of your time to connect to someone who is trying to block an insurance reimbursement for something that is a clearly indicated based on guidelines or based on that specific patient's presentation. And physicians are already so busy, and so that's just, I think, a huge challenge. And then on the personal side, I've had issues. I have young children, and I've had issues with I've seen clear errors where things that I know should be reimbursed, like annual vaccines for my kids that didn't. And of course, I didn't pay that bill. I had to chase it down. But I think about all the patients or the families that don't know this and end up overpaying for things due to error and insurance billing
They tried to
side.
charge
Or
you? Like,
yeah, tried to charge me, or most recently what I've had. And so sometimes where automation can be an issue. Most recently this year, I noticed, I mean, I switched jobs too, so I don't know if that's been around for a while, but HSA can auto pay your bills with whatever was uncovered by insurance companies, which I do not recommend until they iron out the kinks. But out of very few bills this year that were auto paid by my HSA account, at least two, um, the HSA paid, but then the clinic did not get the payment. And so then I had to go through this crazy circular process of confirming that the payment happened. I could have easily not noticed and double paid for the latest issue, which was, I think, an allergy visit for my daughter. I had to um, talk to the HSA company, confirm that they did make the payment and it went through, then go back and talk to the clinic, let them know payment was made. And then they said, okay, but we have no proof of that. So you need to fax us confirmation, go back to HSA, have them fax that. Then they never received it. And they were putting me on sending me threats for collection on something that already came out of my pocket. And not only that, now I'm spending hours trying to troubleshoot this. And so most recently I had to do a three-way call. And so the amount of time wasted for this automation that's supposed to save time has been awful. Needless to say, I've turned off this auto pay feature But I think it, goes back to use of AI as well and automation in general that I think before it saves time and removes barriers, they're probably going to be an increase in error. Um, and trying to make sure we have the right guardrails and catch those errors in time is so important.
Yeah, the going back to peer review, I think that the first time I heard about peer review, I was really surprised that it was a thing because the insurance company, they're not going to hire their peer review doctor isn't going to be like the friendly, I just love approving everything.
Right.
A shark.
Hmm.
Have you had like bad experience of peer review when you were practicing medicine?
Yeah. It's almost always a bad experience, to be honest. And like I mentioned, it's almost never a peer. You're almost never talking to someone at your level of training. It's typically someone with way less training, or different kind of specialty, right? Not to necessarily diminish someone's experience, but there's so many different specialties. And so, as a pediatric oncologist, I think I've never spoken to another pediatric oncologist when doing peer to peer. A lot of times it's mid level providers like nurse practitioners, or physicians who are generalists or have other specialties. And so, then you end up waiting to connect with this person who have like misinterpreted the data in most of the cases. And maybe they think that this patient should not get reimbursed when it's clear that they should. And then once you explain the situation, typically most uh, uh, on the other line would accept that and apologize. Uh, but, think about the delays in care this introduces, and the wasted time for these clinicians in practice who are, have very, very little time to begin with, to then have to explain something that's, clearly indicated to someone who doesn't have that level of knowledge or privy to the necessary data is, can be quite frustrating.
Yeah, I can imagine. And then like from a schedule perspective, like where did you find the time to deal with this in between patients, like the time spent allocation on stuff like
Yeah, I mean, in between patients typically, and like I said, it's just so hard to do. So you are trying to juggle all these things, and a lot of times it's if you don't really have a lunch break, but if you did potentially have a few minutes that you can dedicate to scarfing down some food, then now you're doing it while sitting on the phone, or staying after hours, after you're done seeing patients. And but that's when typically doctors are catching up on all of their charts and all things already is after hours at night, and people have families, and so after their kids are in bed. And in this case, I think depending on the insurance company, they don't even have after hours access. And so you had to find time during the day where, had to make a decision between a bathroom break and making this important phone call to make sure your patient gets the right therapy at the right time and not have to delay treatment, by days to weeks, which can completely change their outcome because of this insurance reimbursement block.
well, in the future AI paradise that Caesar Health is building. This will
Yeah, that would be
perfect
nice.
world. Hopefully.
Mm-hmm.
Fingers crossed, fingers crossed. I kind of wanted to end the podcast talking a bit about cancer treatment. Like, what do you think is the best outcome? Like, what does the future cancer treatment look like? Do you?
Yeah, I mean, I think immunotherapy has certainly been on the rise over the last decades, and so I think it's here to stay. Immunotherapy and um, and targeted therapies. And so the goal again is to put people in more durable remissions or cures, while minimizing side effects. Old school systemic chemotherapy causes a lot of side effects, especially to children, same with radiation. So trying to eliminate as much of that as possible. And that's certainly been the case. All new therapies that we're working on tend to have a much more favorable side effect profile. So that's certainly the goal in, getting people to live longer, better lives with less side effects, is certainly the intent. And then the use of biomarkers to select the right patients for the right therapies at the right time. Circulating tumor DNA, I think, is here to stay and help stratify patients, and guides management on clinical trials as well as in the clinic. And yeah, we're very much looking forward to those advancements in the future.
Awesome. Thank you so much, Dr. Kristiyana.
Yeah, thank you.